Apollo Fertility, Solapur. Today, I'm going to discuss with you about the polycystic ovarian syndrome and infertility. So, polycystic ovarian syndrome and infertility is a very important topic, and it is an heterogeneous disorder which has ovulatory dysfunction, polycystic ovaries, hyperandrogenism, and all it constitutes polycystic ovarian syndrome. So diagnostic schemes by varying experts, they have said there are various signs and symptoms, and from 1990 NIH criteria, 2003 Rotterdam criteria, and then Androgen Access Society 2006, they also have told the various ways to recognize this polycystic ovarian syndrome. So, polycystic ovarian syndrome and infertility is a very important topic. Polycystic ovarian syndrome is a heterogeneous disorder. It has hyperandrogenism, ovulatory dysfunction, and polycystic ovaries. The various diagnostic schemes, NIH criteria 1990, Rotterdam criteria 2003, and Androgen Access Society 2006, they have done this polycystic ovarian syndrome analysis since many years. So signs and symptoms are like hyperandrogenism, जो मेल फैक्टर्स जैसे है वैसी चीजें होना, हर्स्यूटिज्म, चेहरे पे बाल आना या पिंपल्स होना वो बहुत बढ़ जाता है. ओलिगोमेनोरिया, जो ये पीरियड्स है उसके रिलेटेड इरेगुलरिटीज डेवलप हो सकती है. एंड पॉलिसिस्टिक ओवरीज on ultrasound we can see. So there are various phenotypes according to androgen levels, LH levels, ovarian size, AMH levels, and body weight and insulin resistance. And with that, this is a phenotype A, B, C, and D we can see. The main pathophysiology of this polycystic ovarian syndrome is very important, and we have to understand that it can be a genetic cause to it, prenatal endocrine distortions, postnatal, sometimes obesity and diet also is responsible for that. Then fetal development programming is also important, like placental disease, mother malnutrition, fetal hypoxia, or there can be genetic predispositions like familial aggregations, polygenic pathology, and polymorphisms. So, in such cases, there are a lot of oxidative stress, this gene expression alterations, and that leads to compensatory growth of insulin metabolism alteration happens, which leads to hyperandrogenism, anovulation, and polycystic ovaries. Even the lipid metabolism alteration is there, and that leads to this polycystic ovarian syndrome. According to the women's stage of life, So there's a fetal programming, then there is insulin resistance, adipose tissue dysfunction, then at adolescent age, young age, there is weight excess that leads to the hyperandrogenism, hirsutism. Then there is obesity, dyslipidemia, and in later cases, there can be a development of type 2 diabetes, dyslipidemia, cardiovascular diseases, and there is a high risk of endometrial cancers in such polycystic ovarian syndrome cases when they have not treated properly throughout their career. The prevalence in WHO says that it affects 116 million women worldwide in 2012 reports. Globally, prevalence is very high and that can range from 2.2 to as high as 26%. In India, experts claim that 10% of women to be affected by polycystic ovarian syndromes, and yet there is proper statistical data we have to get to confirm these numbers. So the high incidence in South Asian population, the PCOS figures, which gives us this idea. So PCOS basically is not something very weird, very different, and uh, what is this kind of disease? So we have stopped calling polycystic ovarian disease. So we don't call it as a polycystic ovarian disease, PCOD, we call it as a polycystic ovarian syndrome. And 30% of all infertility is associated with anovulation, 85 to 90% of these attributed to polycystic ovarian syndrome. 21 to 59% of women in reproductive age demonstrate USG picture of polycystic ovaries. About 30 to 50% have clinical or biochemical signs of anovulation and androgen excess. Now, what is the treatment for PCOS? Now, as an IVF specialist, I would take you through the IVF, like infertility journey of this PCOS patients. So there has to be weight loss, there has to be exercise, there has to be lifestyle modifications, then use of clomiphene citrates, like this drugs which induce folliculogenesis are important in them because the follicles are not developing. Then sometimes like letrozole, which is aromatase inhibitors, which is important, metformin, gonadotropins, laparoscopic ovarian drilling, which is a very important phenomenon when the AMH level is very high and there is a chronic anovulation or ovulation is not occurring. And in certain cases, we need to go for the IVF procedures, test tube babies. So consensus on infertility treatment related to polycystic ovaries, they can be pre-treatment. पहले जैसे हम डिलीवरी उनका करना है, उनको प्रेगनेंसी रहना है, तो पहले हम क्या करेंगे? प्री ट्रीटमेंट इज लाइक डाइट, एक्सरसाइज and certain other measures. The first line is this ovulation induction drugs such as clomiphene citrate and letrozole. Second line, we can give them gonadotropin injections or the laparoscopic ovarian drilling. And third line is the IVF or the test tube baby. So weight loss and the lifestyle modification is very important, and the obesity is strongly associated with PCOS, and up to 50% of the PCOS patients are obese. So that insulin resistance causes hyperinsulinemia, that causes intra-ovarian hyperandrogen, like male hormones increase, and that inhibits follicular maturation. Now, what is the benefit of this weight loss and lifestyle modification? It restores the ovulatory cycles and achieves, give important is the achieving pregnancy. It responds to the pharmacologic ovulation induction methods, and it improves the obstetrical outcomes and decrease maternal complications such as abortion, preterm labor, gestational hypertension, and diabetes. So weight loss and lifestyle modification. Recommendation is first line option is aimed to reduce 5 to 10% of the body weight. Physical activity sessions for at least 30 minutes per day or 150 minutes per week are recommended. Calorie restricted diet and avoid smoking and alcohol. The level of evidence is limited and not yet demonstrated in high quality studies, but this really very important weight loss and lifestyle modification. So अपने जीवन शैली में बदल करना एंड आहार में बदल करना ये बहुत ही इम्पोर्टेंट है. और वेट रिडक्शन एटलीस्ट 5 to 10% भी हुआ तो भी उसका परिणाम बहुत अच्छी तरह से प्रेगनेंसी रहने के लिए हो सकता है. Impact of bariatric surgery on polycystic ovarian syndrome, and it is a systematic review and meta-analysis that gives a conclusive remark of that bariatric surgery effectively attenuates PCOS and its clinical symptomatology including hirsutism, menstrual irregularity in severely obese patients. So there is some importance of this bariatric surgery in polycystic ovarian syndrome. Now, recommendation says that guidelines recommended that bariatric surgery can be considered after lifestyle therapy fails, and bariatric surgery should not be recommended for the purpose of improving fertility outcome pending further research is there. Now, this recommended first line treatment for ovulation induction is letrozole or clomiphene citrate. And recent randomized controlled trial data and Cochrane systematic reviews findings show that aromatase inhibitor is associated with increased ovulation rates. So जैसे भी ये polycystic ovaries जिनको है उनको जैसे वो ट्रीटमेंट के लिए जाते हैं उनको ये लेट्रोजोल या क्लोमिफेन टैबलेट्स देते हैं and these are important and first line treatment for the ovulation induction in these patients. So uske accordingly they have formulated NIH public access data and which is important, and they are non-significant, and they both are comparable results. Now women with PCOS and BMI more than 30, now it is said that letrozole should be first line of treatment as it increases the live birth rate as compared to CC. So there are various regimens of this letrozole, and we have to understand how this has to be given. Certain cases there are when we frequently give clomiphene citrate and there are not achieved pregnancy not achieved or the follicles are not developed. So accordingly we have to understand it is CC resistance or CC failure. There is another molecule which is very important, and these PCOS patients have to like take that molecule is metformin, and this molecule is important to overcome the insulin resistance. But it alone is not the first line therapy, and combination is beneficial. Now gonadotropins, when we go with these PCOS patients, fail either to ovulate or to conceive with oral ovulation inducing medications, IVF specialists add gonadotropins in IVF clinics. But the ultrasound monitoring is very important when you give injectables because there is a chance of hyperstimulation when we give injectable medicines. So this has to be done under monitored conditions and not in any clinic. So once the dominant follicle is reached appropriate size, this HCG can be given, like trigger can be given, and further natural intercourse or IUI can be tried. Pregnancy rates with gonadotropins increase by 20 to 25%, but the factors which are we have to consider is like cost. Monitoring is very important, and there is risk of multiple pregnancy and development of OHSS. OHSS माने उस polycystic ovaries के जो patients रहते हैं उनमें बहुत सारे छोटे छोटे follicles रहते हैं. When we stimulate those follicles, there is a chance that multiple follicles can get stimulated at a time and may lead to a condition called ovarian hyperstimulation syndrome. गोनाडोट्रोपिन्स के वेरियस प्रोटोकॉल्स रहते हैं. जब आप IVF क्लिनिक्स में जाते हो तो दे विल स्टिमुलेट यू इन दैट मैनर. There are chronic low step protocols. So this exogenous gonadotropins का anovulatory induction में कैसा असर पड़ता है, and all these are important. Now a very important topic is laparoscopic ovarian drilling. This is an alternative to wedge resection of the ovaries. Previously the wedge resection मतलब ovary का थोड़ा portion निकाल दिया जाता था, and that was very destructive. Now this ovarian drilling, laparoscopy procedure में हम कॉटरी से मोनोपोलर कॉटरी से हम पंक्चर्स करते हैं, few punctures, and we remove the androgenic material from the this ovaries and bring that ovary more susceptible for development of future follicles. So LOD uses either cautery or laser to create some superficial perforations per ovary. Now this numbers have changed, and there are various criteria regarding that. So certain resistant cases also will respond after this laparoscopic ovarian drilling. बट एक दूसरी चीज उसमें हो सकती है कि लेप्रोस्कोपिक ओवेरियन ड्रिलिंग, इफ इट इज डन इन अ unexperienced places and multiple punctures are done, there is a risk of decreased ovarian reserve also. Now this in vitro fertilization, in the absence of absolute indication with PCOS and anovulatory infertility, IVF could be offered as a third line therapy where the first and second line ovulation induction therapies have failed. So there are various protocols, but this antagonist protocol is nowadays very much effective for this polycystic ovarian syndrome. So various ways to prevent this OHSS, and there's ovulation induction outcomes. There are various factors which are also responsible for this ovulation induction outcomes, such as patient factors. So patient की age भी important है, उसके साथ वाली चीजें लाइक ओबेसिटी, एंड्रोजेंस, दोज आर इम्पोर्टेंट. स्पर्म क्वालिटी इज ऑल्सो इम्पोर्टेंट. Experience of the doctor, the center, then which doses are used, the monitoring, how it was done, and how it is monitored, that it was a single ET or freeze-all. Many other important things we have to consider when we have to understand the outcomes. So the conclusion is lifestyle intervention is very much important. Both CC and letrozole can be used as a first line. Metformin alone has limited benefits, but it is very important for improving live birth rates and this insulin resistance improvement. The gonadotropins and laparoscopic ovarian drilling can be used as a second line treatment. Metformin improves the follicular milieu and hence fertilization rates. Also, those who fail lifestyle and this ovulation induction, the additional factors, infertility factors are there, then IVF can be used with the antagonist protocol. If this GnRH agonist protocol is used, then there is a high risk of OHSS also. So thank you. सो अभी मैंने जो पॉलीसिस्टिक ओवेरियन सिंड्रोम एंड ये इनफर्टिलिटी के बारे में आपको बताया, तो आई थिंक यू हैव अंडरस्टूड some points regarding that. So I would like to answer the questions you have in your mind. So there's one question is, how can combined hormonal birth control pills be used to treat women with polycystic ovarian syndrome? See, these combined hormonal birth control pills are important when we are trying to regularize her menstrual cycle. So this polycystic ovarian syndromes will present to us like in the adolescent age groups where they don't want pregnancy, or in the age groups where they want pregnancy. So in the age groups that don't want pregnancy, we have to normalize, regularize their periods. So that time, combined hormonal birth control pills are very much important. Along with it, we have to understand is there is associated thyroid problems. Then we have to see their we have to give them vitamin D3 sachets also, and uh, this calcium that is also beneficial in this polycystic ovarian syndrome cases. And one very important thing is when this polycystic ovarian syndrome cases, they don't get periods till they given the medicines. So पूरे साल में उनको मिनिमम 4 बार तो पीरियड्स आना चाहिए. So if that like 8 months, 9 months, you just keep on not having periods, then excess estrogen will act on endometrium, and that might lead to development of endometrial carcinoma. So that is a very important thing, and we have to understand that kind of physiology also in these cases. Then this polycystic ovarian syndromes के जो बच्चियां रहती है adolescent girls, तो उनके लिए इम्पॉर्टेंट चीज़ ये रहती है कि लाइफस्टाइल मॉडिफिकेशन एंड उनका वेट कंट्रोल में रहना चाहिए. Then what effect can weight loss have on women with polycystic ovarian syndrome? मैंने ऐसे भी बहुत सारे केसेस देखे हैं कि जिसमें उन्होंने वेट रिडक्शन ठीक से करवाया. सो हार्मोनल जो इम्बैलेंस बहुत ज़्यादा था बिकॉज ऑफ द वेट, बिकॉज ऑफ द इंसुलिन रेजिस्टेंस, बिकॉज ऑफ द इंक्रीज्ड वेट, that comes down a little, and there is a development of regularization of menstruation also. Even for the infertility patients, when the weight reduction is done, there is a chance of uh, ओव्यूलेशन इंडक्शन ड्रग्स जो हम देते हैं उससे फॉलिकल्स डेवलप होने के चांसेस भी बढ़ते हैं. सो वेन एवर सच वेरी हाई BMI पेशेंट्स कम एंड दे हैव लिटिल टाइम for the pregnancy, I always suggest them then go ahead and do strict weight reduction programs and then plan for the pregnancy. So I always ask them as a preconceptual counseling, it is very important nowadays to avoid abortions in the future or to avoid infertility. The earlier stages we understand what is the exact problem and we can treat that properly. What can be done to increase the chances of pregnancy for women with polycystic ovarian syndrome? See, polycystic ovarian syndrome की एक अच्छी बात तो जरूर है, उनमें AMH लेवल बड़ा अच्छा रहता है, बड़ा रहता है. सो लोअर ओवेरियन रिजर्व तो नहीं रहता. सो उनके पास एग्स तैयार होने का चांस तो है, बट द क्वालिटी ऑफ एग्स इज डिक्रीज बिकॉज ऑफ दिस पॉलिसिस्टिक ओवेरियन कंडीशन. हमको इन पेशेंट्स में देखना है, जैसे मैंने बोला कि पहले ही वेट रिडक्शन करो, इंसुलिन रेजिस्टेंस कम करो एंड देन स्टार्ट फॉर योर ओव्यूलेशन इंडक्शन. The adjuvants are also very important like metformin and other drugs, melatonin and all, to give to stimulate these patients. So in such situations में जब उनका ओव्यूलेशन इंडक्शन चालू हो जाता है तो हम उनको बता सकते हैं कि ये कैसे बढ़ रहा है. वी हैव टू स्टार्ट विद द doses, low doses, see how the follicles are developing. So there is definitely a chance of having pregnancy if we stimulate them properly, do proper monitoring, if required gonadotropin injections to be given, and they can definitely become mothers. एंड वो इंक्रीज करने के लिए वेट रिडक्शन, लाइफस्टाइल मॉडिफिकेशन, डाइट and treatment at the proper places is very important. Definitely PCOS affect pregnancy because follicles तो डेवलप नहीं हो रहे प्रॉपरली. फॉलिकल डेवलप नहीं हो रहे तो वो फूटेंगे कैसे? वो फूटेंगे नहीं तो फिर at the time of intercourse, how they will develop any embryos. So polycystic ovarian syndrome definitely affects pregnancy. So एक बार pregnancy रह जाए तो uh, if she is very obese and all, if she has diabetes, then that will have some impact on existing pregnancy. But pregnancy होने के लिए भी problem हो सकता है, and if this diabetes is not properly monitored, resistance, insulin resistance is not screened properly, then there is a chance that it also has some impact on the pregnancy also. What can high level of androgens lead to? एंड्रोजन्स ये मेल हॉर्मोन्स रहते हैं. फीमेल्स में ईस्ट्रोजन एक इम्पॉर्टेंट हार्मोन रहता है और उसकी वजह से स्किन स्मूथ रहती है, स्किन पे बाल नहीं आते. बट बिकॉज ऑफ दिस एंड्रोजन्स देर इज अ डेवलपमेंट ऑफ हर्स्यूटिज्म, चेहरे पे बाल आ जाते हैं, स्किन कोर्स हो जाती है, वॉइस कोर्स हो जाता है. सो ऑल दीज थिंग्स कैन have the impact on the female body, and उसका like weight बढ़ के improper fat deposition हो सकता है. So ये सारी चीजें excess level of androgens के वजह से हो सकती है. सो आज के ये टॉपिक में मुझे आप सबको बताना है कि ये पॉलीसिस्टिक ओवेरियन सिंड्रोम ये वेरी इंपॉर्टेंट है. उसको ठीक तरीके से, ठीक नज़रिए से देखना चाहिए. इट इज़ नॉट अ डिसीज बट इट इज़ अ कंडीशन लाइक अ डायबिटीज इज अ लॉन्ग टर्म कंडीशन. वी हैव टू डील विथ इट. We have to make certain lifestyle changes. See, even for the healthy patients, we have to have this diet, uh, lifestyle changes important. But for this polycystic ovaries, we have to be more cautious. We have to uh, like follow healthy lifestyles at right time. In adolescent cases, right time, take hormonal pills or show to your gynecologist and get proper medications. And for pregnancy, you have to do preconceptual counseling, understand what is the problem, get ovulation induction at a proper center, monitor it, and you can have definitely have the pregnancy. Thank you.